I'm Kevin Brader, gynecologic oncologist here in West Michigan. I'm based at the University of Michigan West Healthcare in Grand Rapids, but I also see patients at Holland Hospital and work quite a bit at Holland Hospital. And I'm here today to talk to you about ovarian cancer. Well, it's the fifth most common cancer in women in general. The death rate is the highest among ovarian cancers, and mainly about the behavior of ovarian cancer versus some of the other ones. And that's related to the fact that almost all, 2/3 or more of ovarian cancer is detected at an advanced stage. So it's important once it is detected that the appropriate treatment is given. And what it's been shown is that there's clear data that if gynecologic oncologists are involved in the care and mainly give the care, and that doesn't mean we don't, if somebody needs to have chemotherapy at a certain location, that we don't have a medical oncologist see them, but if we are involved in their care from the beginning, the outcome is better. There are not any reliable symptoms from ovarian cancer until it's advanced. I mean, it can be abdominal bloating or nausea, urinary symptoms, but there's nothing classic that would say, boy, that could be ovarian cancer. And most of those symptoms are not ovarian cancer. That's what's important. Somebody does a scan and says, oh, that's nothing to worry about. That's not always the case. And so I think it's very important, if you're not sure, you're not trusting that opinion, we can always take a look at that. And I get a lot of patients for things like that that are told, oh, we don't need to worry about that thing. And it's definitely that we involve gynecologic oncologists right from the beginning. And that's probably the most important thing about this. People always wonder, does it run in the family? And probably up to 10% of patients, it is a part of a familial syndrome, usually related to a gene called BRCA. There are actually two genes, and they're tumor suppressor genes, which work to keep cancers from developing. And whenever there's a mutation in one of those, it allows these cancers to develop. So we test every patient who has ovarian cancer that undergoes genetic testing, regardless of their family history. And that's something that women should always know. They have a right to have that done. The peak of ovarian cancer is about at age 60, I think at 55 to 60. But older ages, women can have it. It's not like certain cancers when it's thought you get to a certain age and the risk goes down. And even in younger patients, certain younger patients they get a different ovarian cancer. It tends to be a low grade or slower growing type. So you can see that in the 20s, but the typical in there is between 45 and 65. So the fact that we find this in an advanced stage, it's important, first of all, to frame that correctly, because it will not be uncommon for people to come to us and been told by somebody in the emergency room or by a primary care physician, this is terrible, you got 6 months to live. And that is almost never the case with this cancer. So I think that's the first thing we do, is kind of set the stage for what we're dealing with and not be afraid of it. We know how to deal with this. This is common how this shows up, and we know how to take care of this. That's the first and most important thing we do. And then the other thing we do is streamline what's done next. I mean, there can be a lot of extraneous and expensive and inconvenient tests that can be done, and we know that there's only a limited things that we need to do. It's treated in one way with a combination of two things, chemotherapy and surgery. Typically, we've always done surgery first, followed by chemotherapy. But what's important is neither one of those alone is going to lead to any prolonged period of being cancer-free. It has to be a combination. So what we offer as gynecologic oncologists is the ability to do the type of surgery that is required for this cancer. So if you have any questions about ovarian cancer in general, or you would like a second opinion, please just feel free to call my office anytime.